Dental implants are a really beautiful way of replacing a missing tooth. It is a minor surgical procedure where we can place a prosthetic tooth root that becomes firmly attached to the jawbone, and then once that happens, we can then attach a crown or prosthesis over that prosthetic tooth root to replace a missing tooth. Very often, if you feel as though you're missing a tooth, you want it back, then it's a matter of having a discussion with us about how we go about it. There are many ways that we can do it, and it's a matter of what's going to be the most appropriate. Sometimes we can close the space up with orthodontic work. Sometimes placing a bridge may be best. Or sometimes we look at placing a dental implant. But we tailor our tooth replacement to each individual's needs.
We have in the practice now one of our great new technologies is 3D X-ray, and what that does is it allows us to get an X-ray which we can put on a computer, and like a CAD CAM, like as they design architecture these days, we can actually swing it around and look at the jaw and the face from lots of different angles. That allows us then to plan where we're going to put a dental implant very accurately to get the very best effect and the very highest success rates. That 3D X-ray has really been a revelation for us. It's still fairly new in this practice. It's been around a while in a general sense, but we're lucky to be one of the few practices in Sydney that have that on-site here. And from the point of view of implant treatments and a whole lot of other treatments, it just allows us to have a full picture to diagnose the very best way of doing our procedures.